my name is Lindsay. I'm a nursing student. I'm going to be taking care of you today. I just have to put some leads on because, you know, with your heart condition, you want to make sure everything's working right, okay?
Okay.
How are you feeling?
I'm okay.
Alright. So I'm going to move your gown just a little bit so that I can put these on. Is that okay with you?
Mm-hmm.
Okay. Alright. Thank you. And who are you to the patient?
I'm her mom.
Okay.
Well, I'm her stepmom. She was adopted.
Okay. Well, it's nice to meet you.
It's nice to meet you as well.
All these wires, they always get so tangled up.
Okay, now what them little things do right there? What you putting on her?
So this is supposed to just be able to help read what's going on with her heart, like her rhythms, and to see if it's regular or not.
Well, is she dying or something?
No.
Let's see.
And then we just have to connect it to this little box. Alright, so we'll just go ahead and cover you up and just call if you need anything, okay?
Okay, thank you.
Of course.
What are you guys having for lunch today?
I'm having a turkey sandwich.
Oh, I kind of want a salad.
They have good stuff down at the cafeteria. Oh, Kelsey, isn't that your patient in AFib on the monitor?
Oh yeah, we're gonna have to go check her out. Hi Shayla, how are you feeling?
I'm okay.
Your monitor up front said you had a little bit of an abnormal rhythm. We want to make sure you're okay.
Yeah, I'm good.
You're
Just
okay?
watching my Jerry Springer.
Okay. Well, I'm gonna check your leads because sometimes that might be the reason behind an abnormal rhythm.
Okay.
Okay. Okay, I'm just gonna get a closer look at where these leads are placed. Okay.
Okay.
I'm just gonna take your gown down a little. Oh yeah, these aren't right. These aren't in the right area. I'm just gonna fix them for you, okay? See if we can get a better read.
Okay.
A little bit of a sticky. Oh my gosh, it's on your skin. I'm sorry.
So why are you replacing those? You guys rushed in. I was a little nervous.
Oh, because if these are placed a little off, sometimes it'll send an abnormal rhythm up front. And we just wanted to come in and make sure that she's okay. But since she's okay, it has to be the leads that cause the abnormal rhythm. So we're just going to make sure they're in the right spot this time, okay?
Okay. Shayla, are you okay? I'm okay.
Are you sure?
Yeah. How do you know they're in the right spot this time?
Well, these two top ones go in the second intercostal space on both sides of the sternum.
Mm-hmm.
And then the two down here go below the ribs.
Why do they all have different colors?
The colors are to ensure we know what place they go in. So a good way to remember, not that you're going to be putting these on, but for us hospital staff, is that the green one goes to the right. And then that one we call grass, and this one's snow, so snow over grass. And then we have chocolate, the way to the heart. And then we have the red and black one. The red one's fire and the black one's smoke, so like smoke over fire.
Was that my stomach?
It was something.
Then I'll just plug this box in here.
So she can eat now that you're finished?
Oh yeah, she can eat. You hungry?
I'm very hungry.
Alright, we'll just get you comfortable. Alright, I'm just gonna go check if the monitor says you're all good, and I'll be back in, okay?
Thank you.
You're welcome.
3 days later.
Hey guys. We just wanted to go over a couple things really quick. We had some incidences where there was some misplaced leads on our patients, and it's been affecting the monitors and the way they get read. So we made a poster board, and we're just going to kind of go over correct lead placement so that our patients can have better outcomes and we are treating conditions properly. So Lisa here is going to kind of demonstrate where our leads need to be placed properly.
A good way to place these leads also is because these are snapped. If you place onto the sticker prior to putting onto the patient, that way you're not pressing down on them at all.
That's a good point. So we're going to do white on the right side of the patient, over green, snow over grass. Oh, sorry. No, you're okay. So our top leads are going to be placed in the second intercostal space. It's really important that they're placed there. If your patient has a pacemaker, you want to place the lead 3 inches away from the pacemaker. The middle lead, the chocolate one, the brown one, is to the right of the sternum in the 4th intercostal space. And then your 2 bottom leads are going to be on below the ribs on either side of the patient. Go ahead.
All right, so we're just gonna do a quick in-service. The goal is we wanna make sure our staff have knowledge of proper lead placement. We would like for our staff to be able to identify improper lead placement. We would like for our staff to demonstrate proper lead placement after this presentation. We went over the numbers, and after this in-service, we would like for our staff to have at least a 10% increase of improvement with proper lead placement. We understand that some potential barriers are between the collaboration of staff with multiple units and patients coming from different areas of the hospital.
Because incorrect positioning of the electrodes can kind of potentially cause harm to the patients, it's really important to have them placed properly. Even if you find that your patient comes back from a procedure and has their leads placed incorrectly by another department. So when we get our patients from other departments, we want to make sure we're fixing those leads and adjusting them. One study concluded that the current practice of telemetry monitoring highlights the need for better education of nursing staff and clearer guidelines to be developed and implemented.
Okay, now we want everyone to demonstrate the proper lead placement. Okay. So I'm from physical therapy, so just learning. Give me a break. I do like all the colors that easily.
Okay, so we're gonna go snow over grass on the right side of the patient. And smoke over fire on the left side. Great job.
Snow over grass.
And
Then we have smoke over fire. And those are gonna go on the left side of the patient's abdomen. And finally, chocolate is the way to the heart. Sweet.
Okay, thank you guys so much for being part of today's in-service. We're gonna come back around in about a week or so to see if there's any improvement on the unit.
Well, I think you should at least leave it in the break room. So that
Oh, we'll leave this here for you with a bag of candy so you can learn.
Nice. Thank you.
Hey!
So I asked the other lady if she was gonna die because I got this life insurance policy. Yes? No?
You give me the 3.
Sorry.
I'm just kidding. Hey guys. Hold on. I feel like
Alright, wait, you might need to cut for a second. I don't know how to
Okay.
box.